So good afternoon, everyone, and thank you for joining this presentation. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. For those of you who may not be familiar with the Women's Fund, we are a not-for-profit organization located in Houston, Texas, and our mission is to provide women and girls with the tools that they need to be advocates for their health. So we do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. All of our classes and publications are completely free. If you're interested in downloading any of our publications, you can visit our website, thewomensfund.org. There you can also find a form to fill out for physical copies if you would like as well. So today we have a presentation over diabetes and risk for vision complications with Anna Gray. Anna, we are so happy to have you with us, and I'm going to turn the floor over to you, allow you to introduce yourself a little before you dive into this wonderful presentation.
Well, thank you, Kayla. I'm so happy to be here. Thank you for having me. You have such a wonderful organization. And as a nurse, I can tell you that health literacy and education is so vital to the overall health of our community. I've been a nurse for over 20 years, and I've always worked with vulnerable populations, such as the elderly and children, low-income families. And I can tell you that diabetes has been a real complication for many people in that risk group. So I'm really happy to be able to speak on that today. Next.
Give me just 1 second here. I'm having a little trouble sharing the screen for some reason.
Oh, okay.
I apologize for that. Why is this doing this to me? Give me just 1 moment. I apologize.
Take your time.
Okay, can you see that?
Yes.
Okay, awesome. Go ahead and go on.
Okay. So one of the first things I wanted to cover is, what is diabetes? Diabetes is a group of diseases that result in too much sugar in the blood. It's a condition where the body doesn't properly process food for use as energy. The pancreas actually produces a hormone called insulin, which helps sugar get into the cells to be used for fuel. Next. There are 3 types of diabetes. Type 1 diabetes, which you'll often hear referred to as juvenile onset diabetes. Type 2 diabetes, which is more commonly seen in adult onset. And gestational diabetes, which normally occurs during a pregnancy. Next. In type 1 diabetes, the body just does not generally produce insulin at all. And so those particular patients will have to take insulin for every day for the rest of their life. Next. Type 2 diabetes is actually the most common diabetes. So the body does produce insulin, but it doesn't use that insulin properly. Next. And gestational diabetes develops during pregnancy. It needs to be managed early on in the pregnancy to prevent any harm from occurring to mother and baby. So it's really important that women get early prenatal care and prenatal care throughout the pregnancy. Next. So some of the common complications of diabetes that we see are chronic or end-stage renal disease, and that's basically where you begin to have kidney failure, and in some instances you will end up either having to have a kidney transplant or you will end up needing to have dialysis because your kidneys will no longer function and filter out the waste out of your body. Neuropathy is where you have nerve damage throughout your body. You'll see many people who have diabetes may end up actually having amputations because sometimes they will actually have sores or wounds to their feet and they're not aware of it because they actually don't feel it. So one of the things that we encourage is for you to do a daily check of your body. If you can get a mirror and look at your body and see if there's any kind of wounds or rashes that you haven't seen before. And if you can get a little small hand mirror and look at the bottom of your feet, that's going to be really good to catch any problems early on. Coronary artery disease, so heart disease is another big complication from diabetes. And then the one that we're going to speak the most about today is vision complications. Next. How to reduce your risk of complications from diabetes. The good news is there are some ways that you can reduce your risk factors. Trying to maintain a healthy weight, um, keeping regular appointments with your healthcare provider. If you are a person who doesn't have a lot of health issues, then the recommendation is that you at least have one annual physical per year. And the reason for that is so that they can catch any new illnesses early on, such as diabetes, and that can minimize any risk factors that can develop from that. As I mentioned earlier, early and ongoing prenatal care, that's vital for women who are in childbearing years. Take your medication as prescribed, annual eye exams, and check your feet, as I mentioned earlier. Next. So the three most common diabetic vision conditions are cataracts, glaucoma, and diabetic retinopathy. Next. So cataracts is the clouding of the lens in the eye. Basically, it begins to look as though your lens is becoming shadowy. It's no longer transparent like a regular lens of your eye is transparent. So it interferes with your ability to see. The cloudier that lens becomes, the less you're able to see. And normally it's treated surgically with lens replacement. Next. Glaucoma is caused by elevated pressure in the eye, and it can cause permanent damage to the optic nerve, which can lead to blindness. It's treated normally with eye drops. And one of the first symptoms that many people will notice when they begin to develop glaucoma is the loss of their side vision. So, like if you look straight ahead, you can normally see outside the side of your eye. They call it also peripheral vision. And so that's one of the indicators that there could be a problem developing if you begin to not be able to see that well to your side when you look to your side. And so you definitely want to go to the eye doctor and get that checked and make sure you know what's going on if you may be developing glaucoma. And incidentally, not diabetics are not the only patients that can develop glaucoma. So eye health is really important regardless to whether you have diabetes or not. Next. Diabetic retinopathy is hemorrhaging of the blood vessels that feed the retina of the eye. It can be treated with laser surgery or standard surgery. Next. So evaluation and treatment of diabetic eye conditions. Comprehensive eye exam. They're going to dilate your eye as a general rule so that they can see in the back of the eye. And that way they can see if there's any hemorrhaging. They can see exactly the overall health of your eye. Corrective lenses may be necessary, be they eyeglasses or contact lenses. There may be a need for some type of vision therapy, and once they determine you need that, your healthcare provider would work with you to help you find those types of vision resources if that's something that you need. Prescription medication as I mentioned earlier, for glaucoma, uh, eye drops is actually one of the standard treatments for glaucoma. And so that's what they're trying to do, is maintain the pressure in your eye so that it doesn't damage that optic nerve. And then laser surgery and standard surgery is also another option for the evaluation and treatment of diabetic eye conditions. Next. So healthcare team members that can help with managing diabetes vision complications. Your primary doctor, so that's your regular doctor, also known as PCP, primary care physician. Specialist, ophthalmologist, that's a doctor that specializes in diseases of the eye. Your nurse, they are a huge resource with education and also helping you find resources. The diabetes educator, because they can help you learn to self-manage your diabetes. The nutritionist or dietitian, they can work with you and determine how you can manage your diabetes along with whatever medication may be necessary, maintaining that healthy weight, ensuring that you're eating the proper foods. All those things can be uh, uh, very helpful in managing your diabetes, and a nutritionist or a dietitian can help you with that. And your social worker, huge, huge resource there. They can tell you the community resources. If you don't have insurance, or if you don't have adequate insurance, you don't have prescription coverage, they can help you find resources that can help you in those situations. Next. So in conclusion, diabetes is a complex disease, but being proactive with your health care can minimize your risk factors and reduce further complications. Next. And so I listed some vision resources: Prevent Blindness of Texas, Lighthouse of Houston, Texas Department of Assistive and Rehabilitative Services, the Division for the Blind, and the University of Houston Eye Institute. All of those resources are really helpful. They each have their own criteria and their own services that they can provide for you. So I encourage you to reach out to them and see exactly what they have to offer for you. Next. And these are just references where some of this material was pulled from. And I'm next. And here's my contact information if you want to contact me personally for any additional information. Anna Gray, RNBSN, and my contact information. And now I'm open to questions if anyone has any questions. Next.
Okay, so thank you so much for that wonderful presentation. A lot of really useful information in there. I know a lot of times when we do talk about complications of diabetes, or not a lot of times, but there have been times that we have talked about diabetes through our virtual presentations. And
you did a wonderful job too, very informative.
Oh, thank you. And visual complications, or if they're touched on, it's really not maybe as much as they should be. So this was definitely a very informative presentation, and I think one that was very much needed.
Thank
And
you.
the first question is, how common is it for people with diabetes to actually develop and suffer from visual complications?
It's actually pretty common, and that's why the recommendation is that if you are diagnosed with diabetes, that you have at least one annual eye exam. So every year you should have at least one eye exam. Your healthcare provider can help you determine if you need to be on a more frequent basis. So if everything's stable, then they'll normally just see you in another year. But if there's some complications developing, then they may put you on a more frequent schedule.
And that eye exam, is that something that you can get with the PCP, or you would have to see the ophthalmologist for an annual exam?
Well, optometrists would probably do the initial one, and that's just like a regular eye doctor that's not necessarily a specialist.
Okay.
Then if you end up developing problems, then that's when you'll see the ophthalmologist, and then he'll follow your care.
Okay. Okay, great. Um, so, have you come across any research or do you have any knowledge about maybe the different types of diabetes or people with, a certain type of diabetes tend to experience visual complications more often? So, maybe, those with type 2 will have more visual complications than gestational or type 1.
Well, the type 2 is the most common, so that's one of the reasons that you do tend to see it more so in that, simply because it's a bigger population of people. And the gestational tends to be self-limiting. So, in many times, it'll resolve itself once the pregnancy is over. Not always. There are some cases where it does continue, but in most cases, it will resolve itself. So, the type 2 diabetic patients are going to be the ones that you'll see most often with the visual complications.
And you're right, that makes sense since it is the most common. So, if a person with diabetes does end up developing these visual complications, I know a lot of times, like their symptoms will get better once their numbers or their A1C gets better. Is that the
Mhm.
same with these visual complications, or does it just depend on, which type of complication it is?
Well, with the cataracts, in many instances, for example, they can do surgery, and it will resolve the issue in many cases. So, you'll still need to be monitored, but in most cases, you will be able to see if that's the only issue you have. Now, let me just say, you can have more than one eye condition at a time. So you can, in theory, have all three. So if you have all three at the same time, even though the cataracts may be resolved or corrected with the surgery, you still may not have the best vision due to the glaucoma or the diabetic retinopathy. But you always want to try to maintain your hemoglobin A1C, because, yes, maintaining your diabetes at a optimum level is going to improve all of your health risk complications. Okay. Unfortunately, um, if the reason you want to really minimize it is because some things you can't go back and reverse. Once it's done, it's done. But if you can catch it early enough, get your early intervention, then you can minimize the effects.
Okay. Great. And I know earlier we mentioned seeing an eye specialist, at least once a year, and then that would change based on if you were having any problems or not. In addition to that, is there anything else that you would recommend or advise for people with diabetes to be doing as far as their visual health goes?
Well, your visual health actually goes in conjunction with your overall health. So, trying to eat healthy, trying to maintain a healthy weight, get moving as much as possible. Now, that doesn't mean I'm telling everybody to go out and run a marathon. You have to move according to what your abilities are at that time. Okay. But even if it just means walking, or if it just means you're at a stage now where all you can do is some arm raises, just get moving. And that's going to affect your overall health. And that in turn is going to affect your risk factors for diabetes. And if you already have diabetes, it's going to help manage that diabetes as well.
All right. And then finally, I just want to ask if you could give any piece of advice. It could be for people who have diabetes, maybe for people who are pre-diabetic, or people who, are not suffering from diabetes or pre-diabetes. I know as a nurse, you see a lot of patients, and if there's just one thing that you could tell the general public about diabetes or visual complications, anything like that, what is one final message that you would like to give?
Ooh, that's a good one. Um, Basically, that you can lead a normal life and be diabetic. We have a lot of new medications. We have a lot of ways to help manage. So there's a lot of team members, healthcare providers out there, resources out there available for you. Just need to reach out and try to find them. Your healthcare provider, if you don't have one, it's a good idea to try to get one. Um, there are resources like the Harris County Hospital District that's out there, so that if you don't have health insurance, you can apply for medical services with them, and it's based on your income as to what you will pay, and your medications as well. So I'm giving that as an example. There are resources out there. Um, so main thing is start out with that annual exam. If you can get that annual exam as your baseline, that's going to kind of tell you what your overall health is. And then from there, you'll kind of know along with your healthcare provider what types of things you need to do next. Because when you get a physical, they're going to do an overall head to toe assessment, but they're also going to do lab work. And that's where they're going to be able to determine if there's something that you can't see. Because normally your diabetes is going to be diagnosed through your labs. That's where they're going to see that there's a problem. So that would be my recommendation. Get your annual physical as a start and know that you can live a healthy and happy life with diabetes. You just have to manage it and be proactive along with your healthcare team in managing your care.
Thank you so much for that advice. I know diabetes is certainly a scary disease,
It is.
especially for those who may be newly diabetic or diagnosed with pre-diabetes. We hear about all these complications and things can be very overwhelming. So just having that small place to start, that just start with getting that annual physical, seeing where you are. I think that's great advice. And I thank you for sharing those resources as well. I do really appreciate that.
Oh, you're very welcome.
Okay, so I am going to attempt to share my screen again if I can find that presentation. Oh, what did I do? Okay, here we are. I am having the most trouble sharing screens today.
It's okay. It's Murphy's Law.
Okay, let's see. Here it is. Play from start. And then I can edit all of this stuff out. Okay, so if you have any questions or comments that you would like to ask us, you can always email us at healtheducator@thewomensfund.org. Ms. Gray also provided her contact information if you have any questions for her. Also, I encourage you to follow us on our social media sites. We post regularly about upcoming events and presentations and things that we have going on. So I do encourage you to follow us there. I want to thank you so much, Ms. Gray, for giving this presentation. We definitely appreciate it. It was much needed. So thank you, thank you, thank you.
Oh, you're very welcome. I hope everyone has happy holidays, and just know that we're in this we're all in this together, and it's going to be okay.
Thank you so much.
All right, thank you. Take care.
You too. Bye-bye.
Bye.
How do I do that? Okay. All righty. Well, thank you so much for closing that video out with me. I can edit out all of the weird parts like this, me not knowing how to end this recording.
It's so funny. It's okay.
But yes, so we are actually going to be going on vacation for the next couple of weeks. Our office will be closed. But after the new year, I will be working on getting the video up and posted to our YouTube channel.
Okay.
So I do appreciate you taking the time to get this together. I know you had a lot of stuff going on in your personal life. But again, this is something that we didn't touch on ourselves very much. And I think it's probably something that people maybe are not as familiar with as they are with other complications like neuropathy or kidney
kidney
failure.
disease.
Yeah, yeah. So thank you so much again for doing this.
Oh, you're welcome. You're very welcome. And thank you for asking me. I really appreciate it. I enjoyed it.
Great. Well, have a great holiday.
You too.
Bye.
Bye bye. Take care.